Hello, hello everybody. Welcome to Econ Care channel. I'm Tarun. I would be a moderator for today's podcast. So today's podcast is all about vision health. We have our esteemed speaker Chandrasekhar, and little bit about Chandrasekhar sir is he's an alumni from Bijplani, and I am Kalkata. He started off working with semiconductors, but lately, last 10 years back, he's started off Fortis. A warm welcome, sir. Hello,
Thank
sir.
you. Thank you.
Hello, sir. So we have another guest also who's going to join us, Dr. Senthil. So there is a slight technical difficulty. While Dr. Senthil sir could join us, viewers, I would say that I know that most of our viewers are in work from home environment, and we are all going through this digital eye stress. And vision health is something that we have to keep an eye going forward. And my request to the viewers is please make the best of this session and take the best of the support regarding vision health. Thank you for your time, sir. And the session is all to you. Thank you, sir.
Thank you. Thank you. Good afternoon, everyone. And my name is K. Chandrasekhar. You can call me KC. I'm the founder and CEO of Forest Health. And I'm going to basically talk about, actually, we had scheduled that Dr. Senthil will talk about common eye problems. And then I'll talk about how do we use technology to screen and ensure that, most of you are safe during this pandemic. But since Dr. Senthil is finding a little difficulty in joining due to technical reasons, I'll probably start off from the screening side and then go. Dr. Senthil will join and talk about eye problems. I hope you can ask any questions during the any questions if you have during the session, and then we can otherwise have a joint session when Dr. Senthil joins. So maybe can you give me the slides, Senthil? Sorry, Tarun. I hope you can see my screen, right? Tarun, screen is visible?
Yes, sir. The screen is visible right now. We are on Fortis Health first slide.
You are? Okay. It's not Fortis, it is Forest.
Forest Health. All right, sir.
Yeah. Okay.
Yes,
So basically, I want to talk about managing common eye problems. Obviously, it would have been great if Dr. Senthil had given you a little bit of an overview, but I'll take a quick opportunity to give you a little overview on common eye problems. And obviously, Dr. Senthil can answer most of the questions or present more in a clinical way. There are several problems which affect our eye in a very normal situation, right? So we have things like conjunctivitis, we have eye allergy, we have dry eye, we have problems resulting from myopia, or what we call as ability not to see the board and things like that. And then we have reading issues, presbyopia. Then we have chronic eye diseases, where we talk about diabetic retinopathy, something which affects the eye due to diabetes. And then there is something called as glaucoma. And there is also macular degeneration, which affects, the macula of the eye. So these are all problems which, affect us. And Dr. Senthil will actually give you a much more deeper overview into some of these problems. But I'll give you an overview of how do we solve this problem regularly by screening. Okay, so the most core important thing out of this is actually screening ourselves on a regular basis to ensure that we don't get into any of those problems. So that's the key, and that is what is the primary message which we wanted to communicate, and especially the fact that we are using a lot of these gadgets, right? So we're using mobile phones, we're using tablets, we're using laptop, and they all emit a lot of light, which is not very good for your eye. And also, there is a tendency that when you're looking at the monitor, you keep looking at the monitor for a long time, right? And there is a rule that you should not look at something for more than 20 minutes, and then you need to kind of look at something, blink. Otherwise, you will get into problems. Dr. Senthil will probably talk much more deeper in that, but I'll only talk about the technology part of that. So we are a technology company. So we have created products out of India, and these products are sold across 45 countries. We have more than 3,000 installations. We are the largest company in this space in India. And what we basically do is we look at two different aspects. One is when we talk about eye testing, generally people think that when you get it in optical shops, because most of the time you will find that computerized eye testing, right? We think that that is everything. That is only one problem. That is problem of refraction. That is where you find out whether you need your lenses, your natural lenses are good enough, or you need some assistance through spectacles or contact lenses to look at an object, because your normal vision is getting a little blurred. So we do that. So that is, we do what we call as objective refraction, which a reading coming out of the machine, and then we have to do what is suitable most to you, which we do use using trial frame and ask you to read a chart. So that is the first thing. The second thing is we take image of your eye, both the front of your eye and back of your eye. The back of your eye is called retina. Again, Dr. Senthil will give you much more overview. But what is very important is we do generally, when you go to an eye hospital, you will get dilated. So what do you mean by dilation? They'll put a drop and allow the pupil to become much larger so that they can actually put more light to find out what problem you have. But whereas when you're doing preventive care, let's say in a diabetic center environment, in a hospital environment, you can dilate. But if you're let's say in your house, or if you are in your company, you have to go back to work in the next 10 minutes. So we cannot dilate. So we need to take your image without dilation. So that's the technology which we have kind of made. So we take image of your eye, both front and back, and then we also do with another device, we do refraction, and then we also look at problems like color blindness. So all the three we do. And then this whole thing, the entire machinery is connected through a platform, in a cloud platform. It passes through an AI engine and goes to an ophthalmologist. The ophthalmologist kind of sees these images and tells whether there is a problem or not. But since it is operated by an optometrist on the field, they actually tell you whether you got a power or not then and there. So we have two reports. One is your prescription, which comes out for your spectacles then and there, and then you can kind of buy a spectacle. Or for your eye diseases, it actually goes through to an ophthalmologist who's remotely located, and you get the report within the next 24 hours to you. And then the third thing which we do is, if at all you have been identified with the problem, then we have an app, which is what we call as the FH TeleEye app, where you can connect to an ophthalmologist using the app, converse with him to find out what was the problem and what kind of treatment you should take. Based on his input, you can decide to go immediately or after some time. So this is how we typically do a eye screening in a corporate environment, or in a diabetic hospital, or let's say even in a pharmacy, right? So this is basically the way in which this whole thing works is, you walk in, you first get imaged for retina, and then your refraction is done. And in the platform, we have this AI layer, and then it goes to an ophthalmologist who reviews, and the optometrist then and there gives you a prescription. And most of the time, we also have spectacles. You can choose then and there and kind of order, and that gets delivered to you in the next few days. And the report from the ophthalmologist reaches you in the next 24 hours. So that way, at your workplace, at your home, at the luxury of that, you can actually have these eyes tested and get our report and ensure that you are not having any vision threatening problems, right? Which is very important, because there is a lot of deterioration which is happening due to the macroeconomic environment we are having right now. Now, what are all the tests we do? We basically do something for color blindness and dry eye What is dry eye? Probably Dr. Senthil will give you much more detailed
We have
review.
Senthil joined, sir.
Okay.
Yeah,
So,
yeah, no,
sir,
I'm on.
Hello, sir.
Yeah, yeah, sorry, I think Casey is managing it. No problem.
Alright.
okay,
I would
okay.
like to
So,
quickly introduce Dr. Senthil, sir. Sir,
yeah,
our viewers, we have Dr. Senthil on board. Dr. Senthil, sir, is our ophthalmologist, and he's a healthcare entrepreneur. Warm welcome, sir. Um, Glad you could join us. Yes, sir. Back to you, sir. Chandrasekhar,
sure.
sir.
Sure. So, and then we do what we call as subjective and objective refraction. So, the objective refraction is something which the machine throws an output, and then the subjective is the optometrist selects lenses which are closer to the reading which came, and whatever is the most comfortable reading for you, lens for you is what is selected, and then you select the frame and coating and all that, and then you get your spectacles. Then you the image we take for anterior segment, so it looks at some of the corneal issues, it can look at conjunctivitis, it can look at cataract. Again, Dr. Senthil will explain what are they. And then what we call as posterior segment, which is the retinal image, which you can find out whether you have retinopathy, whether you have glaucoma, which is loss of peripheral vision, and macular degeneration. And all of this, along with the back-end ophthalmologist, everything is provided on the site, and you will actually get the report of the optometrist for prescription then and there, and then the report from the ophthalmologist is given to you within 24 hours. So you are completely kind of secure on whether what kind of problems you have or you don't have. um, and this is our device. And what we have also done is we have also brought in a COVID-19 safety shield to ensure that there is fair distance between the operator and the patient, and and it is sanitized after every patient. Whatever portion the patient touches, the headrest, the chin rest, and the shield is completely sanitized between one patient to another, so that we ensure that we don't create a problem. And all these optometrists who are working on the ground are fully vaccinated, and ensure that they are not carrying these disease, right? Similarly, we use so this is basically the fundus camera, which takes the image of the eye without dilating. It takes the image of the retina, as well as it takes the image of the front of the eye, the cornea. And this is the device which actually does refraction. So it's a handheld, but for convenience we also mount it on a stand, and this takes very quick refraction reading, and from there people use the trial lenses to identify what is your exact power. And this, we actually, as I told you, we run it through an AI engine, and both for diabetic retinopathy and for glaucoma, as well as for dry eye. And these indications are sent to the doctor. Now the doctor kind of reviews it, and then kind of either accepts it or adds more to that, and the final prescription or the report comes from the ophthalmologist. So it is the tool which just guides the ophthalmologist, and also we can give you pictorially what are the problems, so that the ophthalmologist can also annotate where is the problem, so that when you're consulting another ophthalmologist for treatment, you will be able to kind of explain, this is what I got, so what should we do. So this is what we do. And then we also have this app right now available on the Android, and obviously will be available on iOS also, is where you can actually download the app and connect to an ophthalmologist who is part of the network, and then talk to them, which is a paid service. On after you have received the report will be there in this app, and you can talk to the ophthalmologist saying that this is what is the report I got. Should I, what action should I take? Should I come for treatment immediately? Can I wait for a few days or a few months? Or you can fix an appointment with that ophthalmologist and go to him for treatment. Of course, this is an all India kind of a setup, so you have ophthalmologists all over India, so you can decide to choose whichever ophthalmologist is there in the platform in your city, and either consult him or also go to him for treatment. So that way, in one location, in your working premises, we have all of that. So we have all the devices, we have the platform, we have AI which is in the cloud, and then it goes to the ophthalmologist, who is of course in his own hospital in towns and cities, and they grade and send it back to you. And of course you get the prescription for the optical immediately, and then this report comes to you, and after that you can decide whether you want to consult an ophthalmologist or you can go to an ophthalmologist whom you know. So this is making life comparatively easy. One important thing which I wanted to share with you, and this is because I assume that most of you are from IT and corporate setup. One of the case studies where we did in 5 different locations across India, and now the same numbers are actually even higher numbers are there when we have crossed like 15,000. 35% of the patient were diagnosed with refractive errors and which they were not aware, needing spectacles. 4% of the patients were diagnosed with retinal abnormalities requiring an ophthalmologist intervention. 8% of the patients were diagnosed with dry eye, leading to discomfort when working. And 3% of the patients were diagnosed with early stage of cataract. Of course, one important thing in this is this was not just employees, but also their parents. So almost 99% of the cataract cases were parents of the employees, but all others, most of them were employees. So gives you kind of an overview. And this is not a very old data. This is data old, just 4 or 5 months old. So this is the kind of impact which people are not aware of, and that is what affects you in this kind of a pandemic. Just to give you how, in a setup like this, how it is done in a corporate environment. So people are screened in that position, and they get the comfort of their premise where they don't have to go anywhere. They get screened by the state-of-the-art equipment and reported by an ophthalmologist, so that they don't have to go out anywhere. So this is, and we also share dashboards with those corporates to ensure that they can ensure that their employees can actually go and get treatment. So this is, but one important thing which a lot of people, because you guys are all IT guys, will ask these questions, that how are we protected on our data privacy, data security, and HIPAA, and all of that. So we are a fully certified company, and our credibility with respect to all of this is very well established among the ophthalmology community, and we ensure that we hold the privacy of all our customers. We take it very, very serious, and we ensure that it is not kind of sent out to anybody. So this is what I wanted to present, and I'll leave it to Dr. Senthil to actually explain to you some of these eye problems, so that you will understand this far more better, and will be able to connect this to the screening portions what I talked about.
All right. Dr. Senthil sir, if you may unmute yourself. And we have a lot of questions actually rolling in from the viewers. And meanwhile, I would request all the viewers to get all your vision health related questions in the chats. It could be about your dependents, it could be about your family members, or the self problems regarding vision and the digital stress you guys are experiencing. So meanwhile, Dr. Senthil sir, could you unmute? I think we have just lost him. He should be joining back. In meanwhile, Chandrasekhar sir, if you would like to add up something till the time, anything about
sure.
the eye and the people. So we have a lot of questions. If you could see the questionnaires and anything in relevance, and if you could answer any of them, if anything falls in the relevance. There's a person on talking about the screening aspects also.
Yeah. So there are a lot of clinical questions. I will allow Dr. Senthil to answer, even though I can answer a little bit. What exercise, because I work. So I think one thing Dr. Senthil will himself say, they have what they say is a 20-20-20 rule, which is, you look at the screen for 20 minutes and then for 20 seconds, do something else and come back, so that you should blink, which is very, very important, because in a normal situation we do keep blinking quite regularly, right? But when we are looking at the screen, we tend not to blink, and that is what is resulting in a lot of problems, right? So Dr. Senthil is there, so he will probably present all the eye diseases, and you can ask much more questions to him clinically.
Hello?
Yes, sir. Are we audible?
Yeah. Can you see my screen?
Yes, we can see your screen too.
Okay. So finally, sorry, I think there has been a little confusion, and I tried to log in with the computer.
No problem. We have a lot of questions rolling out in regards to the eye related support, and we would love our users to get those queries answered.
Yeah. I would like to thank Casey first for filling in because he was supposed to do after me. But I think anyway, give a good introduction about the eye screening. So my presentation will focus more on what are the common eye problems which are faced by the younger generation, particularly during this pandemic. There has been a huge usage of computers, and this has become a problem. The children playing games with the mobile phones. The common complaint which we hear from patients is that there is excessive usage of the devices, both by children and by adults, and we see a lot of new diseases and new problems coming in for the patients. So over the next 15 minutes, I will just address about what are all we are seeing, and maybe how do we take care of our eyes, and what we should try to avoid, and it will be very common stuff, and basically focused on the younger generation which are using devices more than 8-10 hours every day. So let us try to understand what is the vision. So the eye is compared to a camera. So because we are all familiar with the regular photographic camera, so the eye is a natural camera, and it has been one of the cameras with the highest pixel, though it's given by God. And just like how the camera has a lens in front, the eye also has a lens inside. And then just like how there is the software or the film behind, there is a protect layer called retina, which is in the back of the eye. And every physics theory holds good for the human eye also. And this camera of the eye, when you see an object, it refracts the light and then gets it focused on the retina. Just like how the camera takes a picture and then gets it stored on the software or in the back end. So the images which we see are being focused to the retina, which gets transmitted to the brain, and then we interpret those images. So the eye is a camera. I think that's the first understanding which we all have to get. And what will my presentation cover is basically I'll talk about some refractory errors. What are the common problems? Because around 20 to 25% of the people wear glasses now. And then, as the presenter said, there is a huge incidence of computer vision syndrome. A set of eye diseases have come in, which are called as computer vision syndrome. Then a little bit about cataracts and glaucoma and diabetic retinopathy, though these are more linked to the older people, but nowadays we see many young people also have diabetes. So it's not that it's only the older people getting diabetes, because there was an interesting study done by Mohan Diabetes Center in Chennai, which found out that after 25 years also 1 in 4 young people also have diabetes. So it's not that diabetes is converted from being an old age disease to a disease of the younger age. And I will also finish with some tips to protect the eyes, because whenever we get patients, they always ask us about, sir, which should we eat for making our eyes stronger, and what are all the things which we should avoid. So I'll talk about some tips to protect your eyes also. So why is, I think Casey spoke in detail about the vision screening and how it is being done. So why is it important? Because 20 to 25% of the people are in any age group are having the refractory error, meaning they need to wear glasses. And in children, there is a particular condition called amblyopia, the lazy eye. Around 5% of the children can be affected by this lazy eye. And if not screened properly, or if not identified at an early age, can lead to permanent loss of vision. Meaning, out of 100 children, 5 of them can actually have some problem of lazy eye also. And only way India has huge population, and there are only 20,000 ophthalmologists. And only way to identify these diseases and then preventing them from getting into a serious condition is by screening as early as possible. And companies like Care, when you are actually going and doing these corporate screenings, I think this is very important, because you are also helping people from getting into serious complications of, say, diabetic retinopathy or squint or cataract and all these diseases. Absolutely. So screening is very important, and that is the only way to save the vision of patients. And So I'm sure I'll just run through what is this refractory error. Myopia, many of the patients wear these glasses. It's also called as nearsightedness, meaning you can see the near things better and distant objects are not very clear. And hyperopia is the opposite of myopia, where you see far things better, but the nearer objects are not very clear. So minus power and plus power. People who are wearing the minus power glasses are said to be myopic, and then the plus power glasses are hyperopic. After 40, most of us also have this condition called presbyopia, where we have to start wearing glasses for reading because the focusing power of the natural lens in the eye becomes lesser once you cross the age of 40. So everybody cannot escape going to an ophthalmologist, because after 40, definitely we should go to an ophthalmologist to get our eyes checked. And even before that, with 25% of the people having refractory errors, we should make it a regular point to get our eyes checked at least once in a year by an ophthalmologist if we have wearing glasses or if we have any symptoms of the eye diseases. So how do we correct the refractory errors? So the most common way is by wearing glasses. I'm sure in your office many of your colleagues are wearing glasses either for myopia or hyperopia or for presbyopia. And second common thing is contact lenses. And if you don't want to wear glasses, the other option is to go for a laser correction surgery. So laser correction has become very common now. And surgical, if you are not able to get corrected using a laser, then you can do an ICL, which is an intraocular lens which is being implanted after removing the natural lens in the eye. So these are just some technical terms. There are 4 ways to correct the refractory error: either glasses, lenses, or by laser, and also a surgical procedure is available.
Sir, I have a request to make. So we have a
Yeah,
lot of viewer queries that are flowing in.
yeah.
So if you could keep the interaction and address some queries and then come
Yeah.
back to the
Maybe can you read out the queries because I'm not able to see here.
Sir,
I'm
if you
not able.
could jump back to the StreamYard.
Dr. Senthil, I'll read for you. So one question says that I have itchy eyes. When I wear kajal, it gets more. Also, I have watery eyes when I lie down on either side. Water starts rolling down my eyes. What should I do?
So basically, I think there are 2 reasons. One thing, this itchiness or this watering can be due to the allergy. Most of the people can have allergy to these kajal and other things. The most common thing, basically, you're telling when you lie down, she is getting this watering is due to dryness. So because it's kind of a mismatching. I say dryness, but
Yeah.
water is coming.
She has
What happens?
watery eyes when she lies down on both either sides.
So when you have dryness, what happens is there is a signal from the eye which goes to the brain telling that the eye has become dry. So the brain sends back a signal asking the eye to produce more water. So that is the reason you have dryness and watering. So maybe 2 things. One thing is if you are maybe you have to find out whether it happened only while using the kajal or it's a general phenomenon. So if it's general, maybe then it is due to the dryness. So I will address that maybe in the next 2-3 slides, because we are also going to talk about this computer vision syndrome. Maybe the dryness and watering is due to computer vision syndrome or too much of using the devices also.
So there are 2 questions on lenses. Okay, so one question is there any truth on the part that wearing lens don't increase the power? Is it better than specs? So she's asking about contact lenses. Is
Okay.
there,
So it's a general, see, when you are up to 18 years of age, when you go to an ophthalmologist or when you go to an optometrist, so they will tell that if you wear glasses, your power will stabilize. But it's basically for compliance. It's not that if you wear glasses, your power is not going to increase. Because as I showed you in the previous 2 slides, the power is due to the length of the eyeball or the shape of the eyeball. So the growth in a human being happens up to the age of 18, 19 years. So till the age of 19, you are going to grow and your power might increase. I'm not telling it will increase for everybody. So it might increase. So irrespective of wearing glasses or not, it's not like a fever, I take medicine, it gets better. So it's, a lot of patients have this misconception that, oh, if I wear glasses, can I remove my glasses next year? Will it go away? It is not going to go because it's not a disease, but it's an anatomical abnormality. But the doctors will tell you, please wear the glasses. Only way for us to motivate you to wear glasses is we'll tell if you wear it, it will get stabilized, or it will not increase, or it will decrease. So that is one thing. Contact lenses and glasses, I think contact lenses will give better quality of vision, but it doesn't mean that the contact lens is going to reduce your power, or contact lens. If you wear contact lens, the power will get arrested. Contact lens is more of a cosmetic device, and the quality of vision compared to glasses might be better in a contact lens compared to the glasses. So I think I
One
made
more.
it clear. Yeah, wearing
I think
glasses is good, but it's not going to arrest the power. It is not going to treat the power. Yes,
Chandrasekhar
that's
Sir, one more
Seshadri,
question.
I'll read it
One
out.
last question before.
Yeah.
Yeah, one question.
Soumya Gupta?
Is the pinhole glass are really helpful to
I'll
correct
read-
eye number?
Yeah.
Actually, the pinhole glass, the concept of pinhole, I showed you in the first picture. The eye is like a camera. So the light rays, when they are focused through a pinhole, without even any lenses, you can see. But what happens when you see through it? It's just like looking at a room, opening up the door and seeing a room, and looking at the room using the keyhole. So the field of vision will be very much less in a pinhole. So these pinhole glasses, the treatment to get rid of glasses, there are drops coming in to get rid of glasses, there are eye exercises which help you get rid of glasses. All these things are just on a trial. I don't think anything, because unless if these things are working, then there won't be so many optical shops around. So the only way to correct your power is either glasses, contact lenses, laser, or surgical correction. As of now, pinhole you will see better, but you won't see anything in the periphery. It reduces the field of vision. So pinhole doesn't help. These are all just like our other treatments or magical remedies coming. So these are a lot of things will come in. There's no proof, or there is nothing which has still come out which is very solid in removing your glass power other than the four which I mentioned.
We're
Sure.
taking up more
Sir, I
questions.
think we should continue the presentation because other questions are more connected to dry eye and so
Okay, so maybe once I finish the dry eye, it will be better.
We'll come back to questions. I mean, I'll read out the questions.
So what happened with this advent of computers, and then so the ophthalmologist started seeing more and more patients coming in with problems of eye, like, sir, I'm not able to see clearly, or there is a blurring, there is watering, just like what one of the viewers said before, and lot of fatigue, and all these things started coming in. So there was we started ophthalmologists started naming it as a computer vision syndrome itself. It's called CVS because over the last 10 years we have been seeing so many patients who are coming out with these symptoms. So it's a group of issues which happens due to increased usage of computers. So the analogy or the pathology behind this, the eye is like a camera, and this camera has a shutter, which is our eyelids. So what happens when we start seeing a computer, or when we start seeing a monitor for a long time, the eye has to blink, and the blinking is the natural mechanism to lubricate the eye. So because see, the eye is also like an engine. So every engine needs an oil, and eye blinks so many times every minute, say 15, 18, 20 times. So when every time there is a blinkage, there is a friction. So what happens naturally is each time you blink, there is tear film flowing into the eye. But what happens when you're looking at the monitor for a long time? So the blink reflex reduces. And once the blink reflex reduces, the watering also reduces. The water production in the eye reduces, and then there is a friction. So that is the mechanism behind which all these problems happen. So every time, let's say you're seeing at a monitor or a screen for more than 20-30 minutes, the blink rate reduces by 20 to 30%. And when the blink rate reduces, the water is not there. It's just like when you don't put oil in the engine starts getting restriction and getting heated up. That's the same problem happening because of the looking at a monitor for a long time. So most common symptoms are people say my eyes are dry, and then I have watering, and then I have burning, and then there is loss of focus. In the evening I cannot see properly, And a lot of people also develop a small minus power when they see the computer for a long time. So these are the most common symptoms of the dry eyes. And kids are also now using so many computers, so they also start getting this computer vision syndrome. So most common other thing is, so this can lead to a symptom complex, but it's not. It's a nuisance, but it's not something which is going to make you lose vision or something which will damage your eye, but it can cause external damage. And the other common question which people have asked is, sir, I'm looking at the computer for more than 8-10 hours. Should I wear this UV protection glasses or these computer glasses? I don't think these are all required, because when you most of the monitors in these days, they also come with those protective coverings. So you don't have to wear a special glass for computer. But on the other hand, if you have a power, say you're myopic, or if you're hypermetropic, or even if you're presbyopic, then even a small power, you have to wear glasses, because looking at this computer will increase the strain on the eye if you also have power and not wearing glasses. So the radiation in a computer is not that high. There is no need to go for those special glasses, which are computer glasses, computer screen. These are all marketing things. I don't think you have to wear those glasses. Uh, so how do you prevent this computer vision syndrome? So basically the thing is, let's say you are on a job to use the computer, but say your profession demand that you should use a computer for 8 hours in a day. But so apart from that, you should develop a habit that you're not more focused on the devices other than the 8 hours. Because what we say is, people see computers at work for 8-9 hours, then they are always on the phone. So it's almost similar. So try to create a workflow or your lifestyle change where you don't use more devices more than 8-9 hours in a day. And second thing is, when you're looking at the computer, I told you about the blinking mechanism. So you have to blink every 15 minutes or so. So take a regular break. Though it's a very simple exercise, but this will help a lot. Don't look at your computer for more than 20 minutes in a day, in a particular time, and then take a short break. It doesn't mean you have to actually get out of your work and do, but at least don't look at the computer and look at a distant object, and take a 20-second or 30-second break. This helps you the eye to relax and also increases the blink rate. And then the monitor level, I think it has to be, many times we sit in a sofa and look at the monitor. The level of the monitor has to be just a little bit below the horizontal. So you just have to look a little bit horizontally below your this thing eyes. The monitor has to be slightly below your eye level when you draw a horizontal line. And then tilt the top of the screen at a 10 to 20 degree angle. And the brightness of the surroundings and the brightness of your screen should always be a little matching. So you cannot have a dark room and a very bright computer. And minimize the glare on the screen. And if you're wearing glasses, wear your bifocal and progressive glasses when you're using the computer. So these are small steps, but will help a long way in preventing or reducing the strain of using the computers. So if these things are not working, then maybe you can use artificial teardrops. There are lots of these medicines like refresh tears and all these medicines. Most of them are only water in the medicine, which is artificial tear. So they don't have any chemicals contained in them. So you can use them regularly. There is no side effect also of these medicines. But you don't have to be dependent on those medicines. But if your symptoms are very high, there is no harm in using those artificial tear and frequent blinking, as I told you before. And if these things are not working, then you have to see the ophthalmologist. And okay, I think now I finished the computer vision syndrome things. Maybe if you have some
questions, sir.
Yeah. I think
what I'll do is, let me just guide Dr. Senthil sir so that he can review the questions, because the questions are a flowing lot, right? So, sir, if you could click on the StreamYard link.
Okay, just give me 1 minute.
Yes, sir.
Yeah.
And you could go on to the comments, sir. Comments.
Okay.
Yes. Yeah, and you could scroll up.
Okay. So most of them are related to the computer. So good evening. The blue cut glasses reduce the strain on eyes as promoted by many eye care brands. I told you, so these blue cut glasses, if you are using the computer, if you are thinking of buying them only for using the computer, you don't need it, because most of the times the computer monitor or your mobile phone, they also come with those standard specifications. So it's more of a marketing thing. You don't have to spend money on those blue cut glasses. So I keep getting stingy white mucus 3 to 4 times a day during my work hours, especially I feel like removing them from the eye. What could be the reason? So this viewer has a stinginess and also a mucus, which is a discharge coming in from the eye. So basically, you have to. I think there is a little bit of allergy. So the allergy is the reason for this. It's better if you see an ophthalmologist and get evaluated by an ophthalmologist, and he will prescribe you with some anti-allergic medicines and also lubricants for this. Feeling eye swelling after watching computer screen, that is basically due to the over usage of the computer, and it's due to the computer vision syndrome. So you have to follow up whatever we have. Due to excessive usage of screen, I have dry eyes. I'm doing water flash. I'm feeling much better. Okay, so she has dry eyes and she's doing flushing her eyes with clean water every day in the morning and evening. Is there anything that she can do? Is basically, if you're not becoming better with this flushing of clean water, maybe you can also try these artificial tears. What we suggest patients to buy one of those medicines and then keep it in your office itself. Whenever you have this dryness, just apply one drop. So we propagate it because it's not a chemical, so there's no side effect of these medicines, so there's no harm in doing them. It's not going to be addictive, and whenever you get if you're having lot of dryness, use it frequently, like 4 5 times. If you're not having it, use it once or twice in a day. Only thing is, these medicines, once you open it up, use it within 30 40 days. Don't because the medicine might have a longer expiry date, but it's once you open it, it's only 30 or 40 days, and it has to be stored in a cool and dry place, if possible, in a refrigerator. So that is the only thing you have to do. I have itchy eyes. Okay, I think we have addressed Hindi. I don't know Hindi. Sorry.
Which question,
Yeah.
sir? Let me help you.
So there's
Can
one
you tell
question.
me the
There's one
patient?
question saying, while seeing screen, suddenly sometimes my eye tries to close forcefully, and one second, and water flows. I feel relief when I pull my skin on my cheeks down sometimes. Again,
So
this
what
seems to be
happens
a dry
is,
eye.
yeah. So what happens is, the glands which are secreting this oil and water are in the lower lid and upper lid. So when you pull your skin down, so maybe there is a mucus, water is getting secreted. So I think it makes you a little bit more relieved. It's basically, so what you can do is another thing. The meibomian glands, which are the glands which are secreting oil, they are located in the upper lid edge and the lower lid edge. So even if you retract your eye and see in a mirror, you can see those small glands. So you can actually do a little bit when you're taking bath. Just take a clean kerchief or maybe a cotton, and then dip it in warm water and just try to massage the glands in the lower lid and upper lid. So you can just, because even the latest equipment, they just do the warm compress and massage for the eyelids, which you can do on your own also. So maybe every day massaging this upper and don't press your eye too much, but just massage your upper and lower lids with the warm water. I think that will also help the meibomian gland secretions become better. So in fact, even I had the dry eye, so this warm compresses helped me, because the meibomian glands get irritated a lot. So when you are taking bath, maybe 5 10 minutes, you can try to do that massage, which will definitely help.
So I'll pick up the other questions which aren't addressed already, sir.
Yeah.
So we have a question from Pradeep Rana. Hi doc, I want to do a laser surgery for my wife eyes. She has a far eyesight issue and using specs as of now. Please suggest, can we do this laser surgery?
Okay, so for you, I think one thing is I need to know how much is the power and if laser can be done, because laser surgery can be done for powers up to -10 or -11. So you cannot do laser for a very high power. So if the power is within the range which can be corrected by laser, I don't know if they have gone to an ophthalmologist nearby. So you go. There are only two conditions. The patient should be more than 19 years of age, because only after 19 the power stabilizes. And the last 1 or 2 years the power should be stable. Meaning, let's say if the power is -3, it should be -3 for the last 2 years. It should not have been -4 or going up and coming. The power should be stable. Then you take the patient to the ophthalmologist. He will do a set of investigations, including the corneal thickness, the corneal. There are a set of investigations which are done before you proceed for a laser surgery. Because the laser actually takes a little bit of the corneal tissue also. So, if the almost 95% of the patients will be fit for laser surgery. So, if she is fit, then you can go for laser surgery. So now the technology has become very advanced. Most common question which people have is, will I get back my power after laser surgery and all? Now there are lots of different advanced technologies available. So the chances of getting back power is very less. So you don't have to worry about that. Just go and meet your ophthalmologist. And if the pre-operative assessment is right, if it's okay, then I think you can go and get it done. So there's nothing to be afraid of. Another question is, will I lose my vision if I have a laser surgery? There's no chance of losing vision. Very, very remote possibility of losing vision.
So that's your answer, Pradeep. So we have an other upcoming question from Tanwar. What they say is, I work almost 12 hours on the screen. What should I do not to have any eyesight weakness?
So basically, I have a few tips. Maybe in my presentation towards the last few slides, we will be having some tips to save your vision. But particularly when you're working for more than 12 hours, as I said, after every 20-30 minutes, just take a small break. And then after that 12 hours, try to give rest to your eye, and minimum sleep required is 7 to 8 hours in a day. And if you are somebody working for 12 hours indoors, there should be some outdoor activity also, maybe a walking or a cycling, or because that will actually, because most of the time we see a lot of people now don't go out at all. So they're always inside the home. So only when you get out, then you have you are going to look at distant objects, and also sunlight is required. So maybe make it a point to have a 1 hour of activity outdoors also, and try to sleep 7-8 hours in a day. Yeah.
The next
And
question
I
is
will
from.
cover with the remaining slides when about the general tips to protect the eye.
Okay, so should we take up another couple of questions? We
Yeah,
have
yeah,
some.
no problem.
Yeah.
Yeah.
All right. So we have one of the question is like, it's not foolproof information, but Preeti says that Sir, मेरी आंखों में बहुत दर्द होता. Please suggest. She has a lot of pain in her eye. Like, uh,
So
well, it's not
basically,
foolproof. It's like it's just that. And we have a question from Ayush Jain. What exercise we have to do in daily basis to protect our eyes? Because I work on my system about 10 hours in a day. After that, also use a mobile. So it's again on a similar earlier theme that you addressed. So I'll just try to find quick questions which have not been
yeah,
already addressed.
regarding this pain question, it's just like we can't give a specific answer, because the pain can be due to multiple reasons, right? From dry eye to even a lot of it's just like commonly old people when they go to doctor, they have this pain. So they will always we generally call it as a pain syndrome, because the old people will always have pain. So we cannot answer based on that pain. Maybe considering the age of the participants, this pain might also be due to dryness, most probably. So she has to follow the other things. Basically.
So, as we will cover in regards to the screen digital stress, we would cover. I'll pick the questions which are not in that theme. So, we have questions from Sharon that does putting cold gel pack on eyes help in dry eyes?
So basically, the gel pack or even washing your eyes with clean cold water will help, because you are what these artificial tear medicines consist is just water. So there is no harm in putting an ice pack. I will suggest more of washing with the clean water, cold water, not very cold, reasonably cold water will be better, because the water actually gets into the eye. Only thing you have to make sure that the water is not, its water is clean, because most of the time the water we use is not very clean. So ice packs are okay, but if you're feeling good, no harm in trying that.
Okay, I'll try to club a couple of questions which are on the same storyline.
Maybe I can take one question. HJ, he says, I have no blurred vision in general, and in my left eye, our right eye appears blurry. Can something be done about it? Should I go for specs? So basically, I think, I don't know if he has got checked his eyes by an ophthalmologist before. So, but when you close your left eye and if you feel that the right eye is blurry, maybe you have some power in that eye. It is better to go and get it checked and wear a glass if required. So maybe that will definitely help, and this will also reduce the strain. Yeah.
Okay, so there is another involving laser scenario. So I'm trying to club these both questions. So one of the questions says that after the laser treatment, or I see in market many types of eye surgery which don't involve laser. Is there a way to find out which is the best for our eyes, like electromagnetic alignment?
Okay. I'm also not sure what is an electromagnetic alignment. So basically, okay, let me clear another misconception. Basically, people always relate eye surgery to laser. So there are lots of eye surgeries which don't require laser. Like see, a cataract surgery, though we call it as laser surgery, is more of a most of the time it's not laser. It's generally for the understanding of the people, we tell it as laser. So we use ultrasonic energy to break the cataract. And even in the lasers, there are different types of lasers. The whatever laser for the younger people is the laser to correct the glass power. So there are lasers which are used for the retina, laser which are used for small babies. Like Forest has equipment to identify the retinal problems in newborn babies, and these babies can also have laser. So basically, one thing is, I think another problem which people have is, whenever you are planning to have a treatment or a surgery, it's good to do some research on the Google, but always try to go and get the opinion from the ophthalmologist and let the ophthalmologist decide which is best for you. It's just like if you are in a software, maybe whatever you know, I may not know. So the ophthalmologist will be the best person to decide which laser is better for you.
We have a slight extension of this similar questions from Lohit in the laser treatment only. I got dry eyes after laser treatment, and because of halos and glare, it becomes hard to drive at night. Is there any suggestions to decrease or correct these problems?
Okay. So basically, one of the most common side effect of laser surgery is dry eye. But I don't know for how much time. When did he have the laser surgery? So, but he doesn't have to worry, because I'm sure this dryness will go away. So he just has to apply those lubricating medicines which the doctor would have prepared, and this halos will also go away. It's just a matter of time. Maybe he just has to wait, because the latest laser technologies, the main purpose of these treatments is to reduce the halos and dryness. Maybe there are some people who have dryness for 3 months, some people who have dryness for a slightly longer time. And after laser, if you're still using the system for a longer duration, like 10 to 12 hours, then please try to use those medicines. I'm sure it's just a matter of time. You will get better with time.
Dr. Senthil sir, so we have, I think we would be closing the session with the digital stress and the whole, because many questions are about the screen time, the association with Indian screen time. So apart from that theme, the last two questions are from a viewer. I have a nearsight issue in my left eye. Through right eye is absolutely normal. Though right eye is absolutely normal. I don't wear any glasses. What can I do to get back to normal vision? Please advise.
So it's very simple. So maybe because you have this nearsight issue in the left eye, meaning there is a requirement of glasses. So go to an ophthalmologist, get your power checked, and wear a glass or a contact lens. I think that is the solution. It's a very simple. solution. You just have to go and get your eyes checked.
All right. So from Jitendra, we have a question saying, "Got dark circles around eyes? Please suggest some solutions."
Okay. So basically, this is another thing. The dark circles are pigmentation. So basically, when people, it gets more prominent when you're not sleeping, when you're over stressed out, or when you're working for a longer duration, or all those things. Only thing is, for these dark circles, there is no treatment like these ointments, medicines. They may not help you, and its only option for you is to either ignore them if they are not very prominent, or there are some people who are very much stressed out with the dark circles. Then the only option is to go to a dermatologist who might use a laser to clear the dark circle. There are lots of these medicines, ointments available in the market. Maybe it might reduce the tinge of the dark circle a little bit, but it will not help it go away totally. So just try to improve your lifestyle, try to sleep more, try to be having a lesser stress-free life. I think that will help reducing those dark circles rather than medicines.
Sir, before we close it with the whole digital stress, because many of the questions what we've seen are people experiencing intense mobile or because of the work scenario, the association with the computer that they have to be in this work from home culture. We'll take a one question which is a little unique from this question topic that we would end our podcast with. We have a question from Amarnath saying that after driving my vehicle, especially in noon, I get severe eye pain. Pain is like a pressure from the inside. Why does this happen? Thank you.
I don't. So basically, this pain is increasing after he drives the vehicle. So what might happen is, see, maybe he is working on the daytime with the computer, so there is a lot of strain caused in the eye, which keeps building up towards the evening. Maybe the dryness also, and then when he is going to drive, that might aggravate the pain. Maybe that is one reason. So, or if there is an eye power, so maybe better to, or there is a severe dryness, better to go to an ophthalmologist and get the eyes evaluated. That will be
All right, sir. So finally, back to you, sir. Regarding many of our viewers, the key most concern is with the technology, with the screen, the association, the digital stress. What are the tips and what's the way forward?
Yeah. So maybe I think basically this is a problem for everybody because now, see, in this meeting we are here for in the front of the computer for 1 hour.
Yeah,
And
yeah,
it's not
yeah.
that software engineers are exposed to computers, even doctors, even children. Everybody has this problem of looking at the monitor for a longer time. So what generally we suggest is, let's say our work is demanding this thing, so we have to do this. There is no other option. But is there a choice after this to not to look at the monitor? If we have a choice to reduce the phone usage time, if you have a choice to reduce the WhatsApp, or if you have the chance to reduce seeing TV for a longer duration, that I think most important, which is required, is the lifestyle change. Other thing is whenever we go to sleep, there is always we have this tendency to look at the phone till the time we go to sleep. So
Yeah.
I think better to get away from the devices at least 1 hour or 2 hours before we go to the sleep. That I think somebody was asking about the blue light blocking and all those things, because that itself will block the blue light, and then the stimulation in the brain also reduces, and that gives you a better sleep. Other thing is, we don't sleep. Minimum requirement is at least 7 hours in a day. That is also suggested. So whatever time you can sleep, but are we sleeping for 7 hours? And the fourth thing is, are we actually doing outdoor activities? Because most of the time we don't have the chance to do the outdoor activities. So going out, walking, and maybe doing some exercises, yoga, and all these things will also definitely help. And food, we have to have food which is more healthy to the eyes.
Achha. Such as you're talking about the nutrition, sir.
Yeah,
Like
yeah,
what kind of food would you suggest to our viewers who
yeah.
wants
Let
to?
me share my screen. Are you seeing my screen now?
Yes, sir.
Okay, okay. So So, what are the common tips to protect your eyes? One thing is having a regular annual eye checkup with an ophthalmologist. Not for everybody, but for if you're already wearing glasses, if you're already having some symptoms, if you're a contact lens wearer, or if you're age over 40, or if you're having diabetes, just get a regular eye checkup, because the common tendency is we have an eye checkup, continue the same glasses for 2 3 years, don't go to the ophthalmologist regularly. I think the first thing we have to do is regular eye checkup with the ophthalmologist. Second thing, you are asking about the vegetables and what are the healthy diet. This is a common question which we face from patients. So basically, one thing is carrots. So why does an ophthalmologist or anybody else suggest carrots? Because carrots are loaded with beta carotenes, and these beta carotenes are rich with antioxidants which help prevent the macular degeneration. And Pranav, Pranav, just 1 minute, sir.
Yes, sir. Sir, Casey, sir, would you like to
Yeah.
join by that time? And anyways, we are in the closure of our session. So, Acha, I think that is what I would
Yeah.
Yeah,
Dr. Senthil.
yeah. Regarding this nutrition, so carrots are loaded with beta carotene. That's the one reason, and the macula, it helps protect the macula, which is the retinal area of the eye. The second thing is the ophthalmologist or the doctor will also suggest fish, because the fishes are having omega 3 fatty acids which help protect the blood vessels. And green vegetables like broccoli, bell peppers, and even the sweet potato has is rich in antioxidants, vitamin C, and lutein. So these are the eggs and milk. These are the nutrients which are good for the eyes. So basically, this picture will tell you what are all the things which are important for the eye: green leafy vegetables, fish, carrot, eggs, and citrus fruits like lemon and other things. And nuts are also really helpful to the eye. And so if you are a contact lens wearer, don't wear it for more than 12 hours every day. And then people have a tendency to sleep with contact lenses. Never sleep with contact lenses. And if you are buying a sunglasses are good when you're going out. Always buy them with UV protective protection. And these are the benefits of the sunglass. And this is what we have already discussed, right? Don't try to read in dim light, and do not look at a bright light directly. And eye exercises, there are lots of exercises available, but as per allopathic medicine, we don't see a lot of benefit of these exercises, but there is no harm in trying those eye yoga and eye exercises. So I think that brings to the end of my presentation.
I
Yeah.
should really
So
thank everyone. Thank you, viewers, and thank you, guests. It was a wonderful podcast. Thank you for your time, and I hope you all took the viewers have really gained a lot of insights regarding their vision health. Thank you for your time, sir. Anything that you would like to add in the last?
yeah, I'd like to thank your company for this
Thank you, sir.
opportunity.
Thank you so much. Yeah, Ekin
Because
Case, thanks for this.
creating awareness is the most important thing for basically, because when you don't have this awareness, you always look at the Google for answers, and then
Yes.
gives you a lot of it only puts you in a lot of confusion. I also thank Casey for also suggesting me, and I'm sorry for this initial confusion, because I was not used to this StreamYard, maybe Zoom or
Totally,
easier.
sir. Totally understanding.
Yeah. So
Uh,
now I'm thinking I'm used to this, and thank you. And these are my contact
we'll
details.
get
You
to
can,
see you more then. We'll get to see you more then because now
yeah,
you're
yeah.
equipped
Thank
with
you.
the environment. Yes, sir.
So feel free to contact me if you have any questions. Any questions unanswered, just message me in WhatsApp. I'll be happy to.
So everyone is rolling out. Thank you so much for the session. It was a good session. Thanks a lot, and people really had a really great time. They're all saying thank you, doctor. From Ekin Care side also, thank you viewers, thank you guests. It was a wonderful session, and if you guys like this video, definitely do like it and subscribe to Ekin Care channel. And thank you for the time. And that would be
Yeah,
that would
maybe
be
we
all of
should
the podcast.
yeah, because he can carry screening a lot of employees. Maybe also add the eye checkup, comprehensive eye checkup in your screening packages. And I'm
Yes,
sure Casey can help with the technology part, and we can help with the ophthalmology part. And because that kind of a system is not yet available in India. Because in abroad, most of the employee screening also includes a comprehensive eye examination, which I
yes, sir.
think companies like Econ Care should also add it up and provide it to them.
Definitely, sir. Definitely.
Thank
Thank
you.
you so much for
Good.
your time, sir. And thank you, everybody. And we would call it a
Thank you.
podcast. Thank you. Thank you. Have a great evening, everyone.
Thank
Thank you,
you.
sir.